Okay, so we have this question about dutasteride versus finasteride and whether or not dutasteride is not absorbed as well, and therefore the systemic concentration of dutasteride is less. And the question is related to the size of dutasteride being potentially smaller than finasteride. Well, you know, it's kind of an appropriate time to talk about dutasteride because I had my dutasteride and TED treatment today. That's what worked for me in terms of restoring the hair in my crown. It worked extremely well. In fact, you know, I just had my treatment, and you can see my crown's looking pretty good. And my kids were taking pictures of my crown a little over a year ago and sending them to me as a joke because you could see through my hair. I was looking bald. So the question again, dutasteride versus finasteride. The whole concept of topical treatment for hair loss is something that I began to explore in 2016. I did it in Rome, Italy. And in Rome, there were some pharmacists who were working with a topical finasteride. One was using an alcohol base, what he called a silica base, and the other was using a lipophilic delivery system, which he called a lipoderm, which we do have a product called lipoderm. One was located in Rome and one was located in Milan. I personally did not believe either product would work well, but I was helping a plastic surgeon in Rome establish her practice at the time. So I began treating some of the Italian patients in her clinic with the topical finasteride. And lo and behold, I had never seen individuals grow hair with a topical product as well as they did with this topical finasteride. So it was that point that I said, this stuff is coming back to the United States, and we're going to start putting our patients on it because oral finasteride had never worked that well. Now, the other thing we noted from treating these young Italian men was that the side effects from the topical finasteride were much less common than they were with the oral finasteride or Propecia. We were growing more hair with topical, and we were getting fewer side effects. So it was a win-win. Now, the negative was the topical finasteride has to be produced by a compounding pharmacist, and therefore the cost is a little bit more. So that's the negative, but the trade-off is you get more hair and fewer side effects. Now, there are products where you can take a pill, like diclofenac. It is a medication for arthritis or discomfort. It's very similar to Advil in terms of its function. It's a non-steroidal anti-inflammatory drug. You can take one pill, or you can put, let's say, a patch where you ail. Let's say you have tennis elbow. You put the patch on the tennis elbow, your blood concentration of that patch will be 1/100th of your blood concentration if you took one pill. So you literally would have to put on 100 patches to equal the same blood concentration of one pill. So the topical is going to work directly where you have the discomfort, or in the case of hair loss, directly where you are losing hair. So it's going to act directly on the hair follicle. And if you are someone who responds to one of these products, finasteride or dutasteride, then you should see an increase in hair. And usually we see an increase in hair at 3 months, with more hair at 6 months, and even more at 10 months. And it continues on out to a couple of years where you tend to see more hair. Now, how long it will last is unknown, but I can tell you that my son, for example, was losing his hair in 2017. He's been on the product ever since, and he has a full head of hair. So, you know, it's worked for at least 6 years without any diminished response. Now, let's go back to the question of absorption. These are both steroids. When you put them on topically, they will be absorbed very well. We can improve the absorption by putting them in lipoderm, which is a lipophilic agent that helps them cross the cell membrane and into the system. We also can put them in other solvents like retin A or other things like this that will help improve the absorption of the product. Now, anytime we add something to improve absorption, we run a risk that you might have a hypersensitivity reaction to this. So we always try to, make a change when we have any type of local irritation. But I don't see that very often. Generally, the products are well tolerated. Now, in terms of absorption, finasteride is a smaller molecule. The molecular weight of finasteride is smaller than dutasteride. Dutasteride has an extra benzene ring. In general, they look very much the same, chemical formula-wise, with an extra benzene ring and some fluoride ions on the benzene ring of the dutasteride molecule. So the dutasteride molecule is roughly 200 kilodaltons heavier than finasteride. And it's also a larger molecule because of that extra benzene ring. So typically, smaller molecules are going to be absorbed better than larger molecules. And so dutasteride, being a larger molecule, probably is absorbed less. So in other words, your blood concentration of dutasteride potentially will be less than with a topical finasteride. Now, I mentioned again, some people are going to respond well to the finasteride, and they'll respond better perhaps than they would to dutasteride, and other people are going to respond better to dutasteride than finasteride. Myself, I went on the topical finasteride. I didn't really see any improvement in my hair loss, but when I combined the transepidermal delivery system, which is the TED made by Alma, which is a laser company, when I combined that with dutasteride, my hair filled in. And so I've been following that now for almost a year. The response for me has been quite good. And now, will that work for everybody? I don't think that it will. And more or less, the way I tend to evaluate the response of individuals to medications is like I'm a matchmaker. Now, you come to me to help me find you a partner, and I might give you the first partner after you tell me what you're looking for, and you probably are going to say no. No, give me another one. And, I may go through 10 before we find the one that works for you. But we have a lot of options, and we also have the tricho test, which gives us sort of a genetic profile on what you might respond best to. I don't love to start with that test, but if you're not responding to what we start you on to begin with, then we're going to start trying to fine-tune it and find something that you might respond better to. And we can keep trying things until we hopefully find the protocol that works best for you. So I hope this has been helpful. And if you have any more questions, put them in the channel, and we'll be happy to try to get back to you on with an answer. Thanks.
ForHair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.